Good afternoon. I'm here today to provide an update on the cluster of active cases of COVID-19 in the province. And today I'm announcing we have one new confirmed case of COVID-19. The new case is a male in his 20s, and he is a close contact of another case. He is at home with mild symptoms. And as a close contact of another case, he has been in self-isolation since the weekend. He initially tested negative, but as per protocol, he needed to remain in self-isolation. He developed symptoms yesterday and was retested, and the positive result came in last evening. As I mentioned, it's a close contact, so not other community spread, and a close contact could include a partner, roommate, or close friend. And it's also why we continue with self-isolation for 14 days as a close contact, even if the initial test is negative. So to recap on the cases announced in recent days, we now have 6 active cases in the province and all reported in the last few days, which brings our total number of cases to 33 since the pandemic started. 5 of the latest cases are Islanders in their 20s, and these 5 cases are all linked. Through our contact tracing, we can identify a probable source of infection for each case in this cluster. So overall, the risk of COVID-19 in the province remains low. All the active cases and their close contacts remain in self-isolation, and public health continues to monitor all cases and contacts on a daily basis. A reminder that these cases are not related to seasonal residents or travel within the Atlantic bubble. As reported previously, the first round of resident, family, and visitor testing has been completed and all are negative. And the second round of testing is now underway. The retesting of staff started yesterday, and we anticipate having all retesting done by tomorrow, Friday, July the 10th. A public statement will be issued when we receive the results of the retesting of the resident, staff, and visitors of Whisperwood Villa. I know we'll all rest easier and feel better when we get the results of the second round of testing related to Whisperwood Villa. Also note, a testing clinic for essential workers, not only truckers, will be set up in the Borden area for Islanders who are essential workers who make frequent trips outside the Atlantic bubble for work. And this will be available on Monday. We are working with Health P.E.I. on this testing clinic. We are also working to improve the appointment scheduling at the testing clinics in Charlottetown and Summerside. Until Monday, we encourage anyone, including these essential workers, who need to be tested, or anyone who has symptoms, to call 811 or the phone number for essential workers, 1-855-354-4358. I know some of you have asked and are wondering, what are the ideal conditions to transmit COVID-19? We know that COVID-19 is most easily transmitted by using the 3 C's: close contact for a continuous period, usually at least 15 minutes, in a closed environment. And typically, close contacts of COVID-19 cases are partners, roommates, close friends, and others with whom they've had close contact in a closed environment. I ask Islanders and visitors to keep the 3 C's in mind and keep their circle of contacts small. Wearing a mask indoors in situations where social distancing or physical distancing cannot be maintained is strongly recommended. Non-medical masks are effective in limiting the spread of COVID-19 in indoor closed settings. The processes we have in place in P.E.I. continue to be effective in containing the spread of this cluster of cases. Over the weekend, Public Health was able to do the contact tracing, and all cases and their close contacts are required to self-isolate and are monitored. And the daily monitoring includes health screening and allows us to identify any changes, including the onset of new symptoms. And I know there's much attention to the impact of COVID-19 on seniors, especially those in residential facilities. But we are observing an increase in the incidence of COVID-19 in the 20 to 39-year-old age group in Canada and elsewhere. And we are learning that young people are susceptible to COVID-19, and age does not protect anyone from getting COVID-19. So, and I know we have said this regularly and almost daily, it's important that we do comply with some of these public health measures, regardless of our age. We know that COVID-19 has not gone away, and it will be with us for a considerable period of time. We should not let our guard down, and we should remain vigilant. And now is not the time to become complacent. I ask Islanders, as always, to continue to work together and take the steps to protect ourselves and others from COVID-19. It's still really important we remember the basics of washing our hands regularly, maintaining physical distance, wearing a mask indoors when it's difficult to maintain a social distance, and calling a family doctor, nurse practitioner, or 811 if we have symptoms related to COVID-19. And finally, it's really important that we remember to be patient and to be kind to ourselves and to one another. Thank you. And I'll open it up for questions.
Brian Higgins, CBC.
Good afternoon, Dr. Morrison. You mentioned this new case was originally tested and was negative, and then got symptoms and was positive. So I'm just wondering, how common is that, and how worried should others be who have been tested in the last 5 days?
Well, it is common in the sense that if you test people too early in their exposure, and everyone's different. So sometimes people don't get symptoms for a few days. Most commonly, people present with symptoms 5 to 6 days, but the range is really from everything from 2 days after exposure to 12.8 days. So that's why that period of 14 days in self-isolation remains really important.
And have all visitors to Whisperwood Villa now been tested?
Yes.
You said the other day that you were still trying to reach some of them by email?
Yes, all the visitors that we were hoping to test have all been tested, and those results have come back negative. And they will be retested as well.
Thank you.
Okay.
Allison Jenkins, The Guardian.
Hello, I have a question about an unrelated matter. It's about 3 overdose deaths that occurred this past weekend. I'm just wondering if you can confirm that that was indeed something that happened.
So I certainly cannot confirm 3 overdose deaths, and our information in terms of any overdoses relating to deaths is also confirmed by the coroner. We do have an update that I can speak to in terms of numbers of fentanyl specific and opioid related overdoses, but I'll do that at a different time.
Okay, thanks. And can you remind us of the things in place for people who are struggling? I understand that because of the pandemic, there has been a change in services that are getting offered by the detox center, and other places that would normally be offering services have been repurposed. Can you update that?
So I think that's usually something that, Allison, that's updated through Health P.E.I. Through their services, and we can highlight that for Marion to update next time she's here.
Okay, thank you very much.
You're welcome.
Louise Martin, CBC.
Hello, good afternoon. Dr. Morrison, I'm just wondering about the new testing clinic that will be opening up on Monday in the Borden area. Is this going to be in the same location as the previous clinic, the one that recently just closed down?
No, it will be in a a different location, and that's partly logistics because of all the extra traffic and streaming of lanes of traffic. I think, and it's not just for truckers, it's for other essential workers who may be traveling in and out of the Atlantic bubble a lot or frequently, so that they need to be tested to try to get out of self-isolation. So it will be not far away, but it won't be in the exact same spot.
I understand. And was this sort of in direct result of some of the concerns that the trucking industry raised? And will you have to make an appointment at this particular clinic?
So I'll address the second part first. So you will not have to make an appointment, and they didn't have to at the previous testing clinic. I think certainly hearing the concerns was part of it. We knew that the numbers, based on the numbers we had, because we've been doing that trucker clinic at Borden for a number of weeks, so we knew what the daily numbers were, and when the Atlantic bubble happened, that number significantly reduced. It would be a very small number per day, and they would have access to being tested elsewhere. But we recognizing the concerns that they have, and also trying to accommodate other essential workers. We've asked Health P.E.I, and Health P.E.I is working with us closely to see if we can have something that is available for all essential workers in those situations.
Thank you very much.
You're welcome.
François-Pierre Dufault, Radio-Canada.
Bonjour, Dr. Morrison. Je me demandais si vous pourriez répéter en français l'information concernant le plus récent cas que vous avez annoncé aujourd'hui.
Et je m'excuse que je n'ai pas fait en français. Bonjour, c'est qu'on annonce un autre cas aujourd'hui qui est relié, c'est un contact d'un cas sur le week-end. Il est dans ses 20e âge, et puis depuis le week-end, il est en isolement, et alors il a eu les symptômes hier, il était testé, puis j'ai eu les résultats hier soir.
Le fait qu'il n'avait pas de symptômes lors de son premier test, en fait, le premier test était négatif, et qui a développé des symptômes par la suite, est-ce que ça vous inquiète particulièrement, sachant qu'il y a beaucoup de personnes âgées dans une résidence qui ont été testées en lien avec cette éclosion-là?
Alors, ça m'inquiète toujours. Je pense que je suis toujours un peu inquiète à propos de notre cas, les contacts, mais pour moi, ça m'indique que c'est tellement important qu'on continue de faire isoler les personnes, même s'ils ont des contacts qui sont près d'un cas. C'est tellement important, même avec un test négatif, qui reste isolé. Et c'est pourquoi on fait ça pour tous les gens. Et puis, on sait qu'il y a des fois les gens qui n'ont pas beaucoup de symptômes. Alors, et puis, si des fois, si on a des symptômes, ça peut arriver de 2 jours jusqu'à presque 13 jours après. Alors, c'est pourquoi un test juste au début, c'est pas une réponse, c'est pas la solution pour ne pas auto-isoler pendant les 14 jours.
Merci.
Steven Easy, The Guardian.
Hi, good afternoon. I guess just going back to the question from Allison about the reports of more overdose deaths, I mean, we've already had 4 confirmed overdose-related deaths, 3 linked to fentanyl. If these reports are true, that brings us to the highest recorded accidental overdose total on record, or at least tied for 2018, and we're only halfway through the year. So I'm wondering why we haven't sort of gotten the information, if there is some coming from the coroner so far, and when we might be able to get that information.
Yeah, and Stu, it's, I think we've spoken about it here before. We have actually met with the police services and our coroner as part of our rapid response to any overdose. We have a response plan in place, so we actually met with them to review that recently. We are doing ongoing surveillance on a weekly basis. It is updated on the website, and so I'm happy to bring all those updated numbers here. And I mean, that wasn't the intention of today, but I'm happy to do that at any point in time. And it's absolutely, we actually also send a note around to all physicians and nurse practitioners and others at Health P.E.I. Alerting them to what we have been seeing and asking them to make sure that they test for fentanyl if they see any overdose. So that has been all ongoing, and but I'm happy to share more details when I have the other numbers in front of me.
Okay. I guess just as a follow-up, I mean, your counterpart out west, Dr. Bonnie Henry, very early on in this pandemic, promoted, I guess, the policy of a safe supply. I mean, other provinces have, for quite some time put in place things like supervised consumption sites. So I guess from a public health standpoint, are these measures something that should be considered, in P.E.I. if we're experiencing an increase in accidental overdoses?
So we have been having ongoing conversations about whether it's supervised injection sites, which certainly would have a certain number of people. Vancouver is a different population in terms of its population size, for instance, than Prince Edward Island. We actually are in discussion with Peers Alliance about possible pilot with to assist in this regard. So, and I'd like to sort of confirm with them and finalize the details of that project before making a public announcement on it. But it's in that area as well, Stu. So I think certainly you'll hear more about it.
Okay, thank you.
Steve McKinley, Toronto Star. Steve McKinley, Toronto Star.
So I think that's it. Okay. Thank you, everyone.